We don't have that many yet, but we're still going to start. I'm from Region Lab, and I'm going to introduce our speakers for today. First of all, thank you for coming. And the session is actually dedicated to PRP, and we are going to look at PRP use in combination as well as PRP use as a standalone. Our first speaker for today will be Dr. Van Ravi Vachatimanon, He's a dermatological surgeon. She's also CEO of her own clinic, and she's a KOL, opinion leader for a number of companies in the aesthetic industry. And today she will share with us experience in using cellular matrix in combination with threads. So from hello to halo, nothing more to further ado, and the floor is yours.
Thank you so much. Thank you for your kind introductions today. It feels like it's very open up here on the stage, isn't it, to be alone? But I don't think I would be sitting on the chair if that's all right. If I think it would be, it's early in the morning. I think we probably wanted to just have a close chat, really, because it's just something that I wanted to just share, one of my favorite indications. So anyway, I'm Kwan Vanarvivashadimanon. I'm a dermatologic surgeon from Thailand, and it's my greatest pleasure to be here at IMCAS. And thank you, Region Lab, for inviting me, to share one of my favorite indications to help the under eye problems. So let's have a look. So first of all, I think, without a doubt, I think it's one of the common problems that patients, when you come in, they would say something about, they don't like about their eyes. It's so saggy. It looks tired. It's because of the eyes is actually one of the aging signs that you probably see, because it's the thinnest skin in our face. So without doubt, it's the first one to go as well. So you could see the volume loss. You started to see the saggy of the skin because it's thinning. The ligaments started to sag. And then once you can't hold the volume, you started to see this subauricular fat herniation out more, causing that eye bags. And then you get the vascularity as well, that causing, that purplish under eyes that we don't want it. And us girls probably spend tons of money finding the best concealers, right? But because it would be even better if we wake up with the bright eyes without having to cover up with the concealers all the time, isn't it? So if you wanted to know how to cover up the black eyes without makeup, so listen to this lecture, okay? Other than that, the melanin deposition. So with the melanin, as you get older, the melanin activity is different as well. It started to not function properly. It causes more melanin than usual, and that's why you see all the pigmentations under eyes. So the common concerns are the dark eyes and the tear trough, which there are many other problems as well that can be congenital, because sometimes you see patients really young age. It's like 20-something, and they come and complain about, I have really hollow eyes. Can you fix me, please? So it's not just, old age problems. It's to do with congenital structural problems as well. Or it can be environmental. So if you're out in the sun a lot, you do a lot of sports, so you get a lot of sun damage. Of course, it's going to go first. And or with the drugs, or even if you have eczema. Who has eczema here? I have eczema, really bad. So I always get this really bad under eyes because I like to rub my eyes. It's very itchy in the morning, and it's horrible. So how to fix that? Right, there's so many things, there's so many problems. But at the end of the day, I think, you have to understand what the problem first. If you want to address it properly, you have to know what the problem first, and then you can tackle it properly. So, how can we tackle it? First, the easy peasy one, topicals. What do we usually use? Just under eye creams, right? We spend loads of money on under eye creams, tons. And Does it really help? Yeah, for the hydration, it's good enough for the hydrations, but usually things like arbutin or retinoid or those what they call like very gentle chemical peels, it helps a bit, but it doesn't fix the problem like straight on, right? The patient usually comes in and see you and I want result now, I want to look good now. It's going to take a long time. So, or else it's going to cause irritations because these topicals usually, it's very common that it helps to increase the turnover of the skin more. So, cause the irritations, cause more irritation. Of course, you irritate, you scratch your eyes even more, and then causes even more pigmentations. So the circle go round. And the efficacy varies from persons to persons as well. So what are other things? Lasers. So with lasers, there are many lasers that, with researches that proven that it actually helped. I've used lots of picos as well here. Not so much for the ruby because of our skin type is quite dark, and with ruby you could burn easily. Especially when it comes to the under eyes, it's very thin. You might be prone to burns even more if you don't adjust the right parameter. Other than that, intense pulsed light IPL is actually very good, according to the review paper. But to be honest, in my opinion, I've tried so many. The results so variable. I mean, with picos, it's probably one of the best pigmentations for skin type like us, 3, 4, 5. But it will come back, it will recur. Every other, it will take about, you have to repeat the sessions about once every month for about 3 to 4 times at least, and then it will come back within 3 months if you're lucky. So it's not long lasting. So is there something else for us to do? Fillers? I do fillers. Honestly, I do use fillers. And I enjoy using fillers because it really helps for the volume replacement. For those that actually have the hollowness that due to volume loss or the structural bone loss, you still need it. But, of course, there's so many problems, right? Nodules and Tyndall effects and oval field. And it's very difficult because it's a very difficult area as well as it's dangerous as well. So sometimes people don't really want to use fillers anymore. They want something more subtle, even though they know that it won't completely, fill the hollowness, but at least it's more subtle. At least when they smile, there's no lumps and bumps, which, makes it so unnatural. So what is it? PRP. So with PRP, I've come across it about close to 5 years ago. And we had research for melasma first. It worked really well for melasma and pigmentation problems. And I thought, how about with the under eyes? Because it's a very difficult thing to tackle. And apparently, with PRP, it helps a lot somehow because it reduces the inflammations of the skin. It also strengthens the skins as well. It really helps because with our predate-rich plasma, it has all the nutrients, the vitamins, the hormone, electrolytes, everything that helps to strengthen the skin, not only just to fill it, but to actually strengthen the skins as well. And with the plasma proteins, it actually helps this fibrin formation. It's like a scaffold. With the thinning of the skin, if you think about it, if you use things like fillers, it's just, just fill, and fill, never ending. It's so unnatural. But then with this, if you actually strengthen the skin and make it even thicker, do you remember the picture where I show you where there's a pseudo herniations of the eye bags? It's because of the ligament, it's sagging. The skin is not strong enough to hold the dam, right? So therefore, if you actually strengthen that dam, of course it's going to push that back, right? So you have to kind of not just to treat the problem as well, but to protect it as well, for it not to come back too early, right?
And other than that, there's cytokine modulations that help to reduce the inflammations of the skin as well. So with eczema, it really helps as well, because no matter how much I put on under eye creams or I use so much steroids, it doesn't really help, to be honest. So with this, platelet-rich plasma with all the TGF, all the growth factors, it's very important that it helps to stimulate the fibroblasts and the angiogenesis, tissue repair. That's what we want, okay? This tissue repair will help us to strengthen our skin. But at the same time, PRP also helps to reduce the activity of the tyrosinase, which has the anti-melanogenic effect. So it helps those under-eye dark circles as well. So this is brilliant, right? It seems really good. But I mean, I think overall, not only that it helps with providing the volume, it also helps to strengthen the skin, help the elasticity of the skin as well as it helps to have a long effect as well for it not to come back too soon. So if you see in this study, you could see that there is the reduction in the redness as well as in the melanin index, the darkness of the skin, yeah? And how long does it last? So with this, there is a study where they did 3 months injections monthly for 3 times, and actually it can last up to 6 months, which is pretty good, isn't it? 6 months is good. Nothing's long-lasting, as we all know, right? But what if we wanted it to last a bit longer? PDO, that's what I thought. Because there's something else that we can actually do to help the structural support. That's what I thought. Because with the ligaments, that it's weakened, right? And I kind of wanted to just help to strengthen that dam. How are we going to do it? I don't want to use fillers. It's a dynamic area. I want to smile and not having all those lumps and bumps. But how? So I chose this PDO thread. It's a spring thread. It's very mobile. It stretches as you move. So the orbicularis oculi is in circular muscles, isn't it? So when you smile, it stretches in a circular motion like sphincter. So this spring, it will stretch as well. So when it stretches, it's very natural. You can't even see it. It's very seamless. And that's what I want. And other than that it has the volumizing effect and the structural support. It also helps with the melanogenic effects as well. So because of it's made of PDO, it helps the melanin to function better. So therefore, it reduces the pigmentation too. And hopefully, I thought, it might help the effect of PRP to be even better and last longer too, because PDO lasts for 6 months. So let's see. That's a theory. After all, it's a theory, but let's see how it goes, okay? So with PRP and HA. So why do I use with HA? The thing is because it all came from Region Lab that they use HA for their knees. And they found out that it actually helps to promote the activity of the PRP to be even better and last longer, right? It helps with the pain relief as well as reduces the inflammations and modulating the cells' functions. So overall, if you think about it, the plain protein, the plasma proteins, it's good for the cell migrations, right, for the tissue generation, as well as the hyaluronic acid. We all know that it attracts water a lot, like 1,000 times of its molecular weight, which is a lot of water, which helps the skin hydration. It's good because mostly if you injected PRP before, it doesn't really help you with the volume, right? It just goes flat, and that's it. But then most of the time, when the patient comes in and see you, they expect result. They want something different. A little bit of hydration on the skin. Yeah, I think that will please them a bit, that, okay, at least I come in and I actually look better and I feel better when I go out. So with HA, I think that will help. But not just that, it gives in the hydration and replaces the volume loss, but it also helps to give the mechanical support for the PRP. So imagine when you build a house or a building, you need a scaffold first, right? So you need a scaffold, so hence HA acts like a scaffold. And then when you put in the PRP, it's like a mortar, so you can just, it's strengthened the whole thing, the whole building, right? So same thing, the same thinking. So with PRP, it helps the healing effect, it helps the HA that's supposed to have a little bit of inflammatory response sometimes, but it helps to dampen that and also stimulate those effects of anti-melanogenic and irritations and strengthen the skin even more. So overall, with PRP and HA, we have the volume restorations, we can help with the fine lines and wrinkles, it improves the skin texture and hydrations, and lastly, improve the hyperpigmentations, which, you know, the topicals and the laser doesn't really help that much. So, have you done any other research? Yes. Actually helped a lot with PRP and HA. They've been found that it has helped to increase the brightness of the eyes, and also helps to reduce the wrinkles as well. And there's this interesting studies in Jordan where there's 50 patients that they did a study in the under eyes. And they found out that the under eyes actually improved after about 3 months, and it lasts up to about 6 months. So that's good actually, because it's something's very natural, and of course we all know that nothing lasts, but if it lasts for about 6 months, that's brilliant. So why choose Region Lab? I think that's a good question, because there's so many PRP out there right now, and we don't really know which one's the best, right? Because actually, I could just get a PRP from other brand, and then I could just pop in whichever HA that I like, and then there you go, you have it. But the important things with bloods and everything is that the quality of it and the sterility of it, yeah? First of all, the technology of the Region Lab, okay, you only need about 4 ml of blood, that's it. That's very minimal, tiny bit, not even a teaspoon, right? A teaspoon is 5 ml, and that's it. And then you can come up to about 5 or 6 ml, depends on each patient, and that will cover the whole face. And also, it's a closed system. Closed system is very important, sterility, okay? You want to inject anything into the face. You don't want to inject germs and bacteria into your face, because the patient's going to come into you and swollen, and you need to admit them into ICU. No, you don't want that, okay? And mechanical separations of the PRP, it's so easy. Within just 5 minutes, it spins for you, and then it leaves this part that you could just use without having to go over and trying to separate them. Oh, I can't use this part, or I have to separate this. No, you actually know which part to use, because they separated everything for you already. Easy peasy, okay? Dummies can do it too, very easy. For me, I find it very difficult to, come about, okay, I can't remember, there's so many things, but this is so easy, okay? And so therefore, you want everything to be simple. So once it's simple, you can replicate, you can teach other doctors in your clinic as well, which is very important, because you're not the only doctor working in the clinic, right? So you want other doctors to be able to do it as well. Other than that, they have the certified technology that will help to combine HA. It's important because PRP is not just like other PRP, that like a solution that once you incorporate with an HA and then it just goes as smooth. No, it really depends on the HA itself too. So with this, it's like a cocktail for you already. You don't need to go about and mix it all together yourself. It's already done for you. Easy. Other than that, it contains 20 milligrams of HA, 20 milligram per ml. So in there are 2 ml in the tube. So when you mix all together, there's roughly you get about 4 to 5 ml altogether. As you can see, with Region Lab, it's standardized, leukocyte reduced, and easily reproducible with minimal variable. Because it's very easy. You just take in the blood, put it into the tube, spin it, there you go, voila, you're done. You don't need to put in anything, making cocktails or anything. No, everything's done for you already, very easy. And you'll be able to get high platelet recovery as well. So it's only 4 ml, but you could get like 70% of that, of the platelet, and that's more than enough. That's high quality stuff in there already, okay? And there's no loss of growth factor as well, which is the important thing that you don't want to lose, right? And the fibrinogen. Other than that, there is a reduce of leukocyte. So why don't we want leukocyte? So imagine with white blood cells, it's a good thing to have white blood cells, right? In order to repair. But imagine white blood cells causes inflammation. Inflammation causes pain. So you don't want that. You don't want your patient to be painful, okay? You don't want it to hurt. So therefore, there's a reduction of leukocyte, which is good, yeah? And there's no red blood cells as well. So it's pure plasma, pure plasma. So with the scientific advantages of Region Lab is it's safe. There's so many publications over Region Lab, over 20,000 papers over this, and all of them have facility of usage as well, not just for the face, but also for the tendon repair, for the knees, so many things actually. Anna here will be telling you all about it later on, about how to use PRP in other indications as well, okay? So, patient selections, very important because you can't treat everyone and not everyone's going to get great results. So if you want good results, you have to pick, first of all, mild to moderate volume loss. So not too much of a volume loss and not too much of the skin sagging, because otherwise they're not going to be happy with their results, to be honest, because it's just not the right type. Have thin skin, okay? And they could have a little bit of pigmentation. And one thing that I didn't add in, but I think it's important to notice, is that the quality of PRP depends on the quality of the health, the well-being of the patient too. Because it comes from your patient's blood, right? If your patient is not healthy, if the patient has high dyslipidemia and on all these drugs already, do you think then the blood's going to be as, the quality will be as good? No, not really. That's only the downside, really. But the good thing about it is that when the patient comes in to see you, and they probably want something natural, something that is not synthetic, that is not like HA, then yes, PRP will be the answer, because it's just your blood. There's nothing else. It's degradable. Okay, so I think they'll be happy with that. So it really depends on the patients as well. Contraindications. So you have to pick well. So if the patient actually have platelet dysfunctions and coagulopathy, of course, they shouldn't be your patients, okay, if they are infected with something. Other things, I think with NSAIDs within 24 hours, I think it depends. Really, I'm not really strict about it. Other things like dietaries, I don't really mind my patients taking them, really, as long as it doesn't interfere with the coagulations, then that's fine, yeah, and that's fine. Possible side effects. I think it's good to address your patients that, okay, this is not going to be like I injected and then, ta-da, I work my magic. No, it's going to be a slight swelling afterwards, okay, which is normal. I mean, you get swellings and mild bruising after fillers as well, right? So very minimal, okay? And early or late infections, I don't think it will happen if you do it, theoretically with the SORA technique. And with pain and numbness, nah. To be honest, if you take the blood, if you draw the blood well enough, you know human anatomy, and get in the right blood vessels, there's no nerve damage. It's very easy. And I think the important thing is that when you talk to patients, it's good to sit down with the consultations and actually tell them, okay, with VIP, the results can be quite variable. It depends on your health. It depends on you as well. I can't tell you that, okay, this is going to be like a great improvement for you. But then I can assure you that there will be some sort of improvement by the last session for sure. But usually with the HA, it will at least help with the hydration. I think this is why I like to use the cellular matrix, the gold one, because at least with the hydration, they'll be quite happy. Because once they come and see you, they expect results, right? And they wanted to see something. And with PIP, sometimes it takes time, months, for the body to actually, take everything in. So I think this is a good answer. Anatomy. So it's all about injections, right? We can't miss it. So, of course, there's cases of intravascular accidents already, and there's blockage and blindness that happened happened before. So it's good to know the anatomy. Of course, the important thing is that around the eyes, we know that the facial artery comes wind up around here and gives off the angular artery. It also can anastomose with the infraorbital artery here. The infraorbital arteries are branches of God, I lost my word today. ECA. Actually, I had a really awful night last night. I had a really good dinner last night, and somehow I probably my tummy is not good with the sashimi. It didn't take me well. I woke up 5 in the morning, and yeah, I spent a lot of hours in the loo this morning. So I'm sorry, my head is not really functioning properly at the moment. But anyway, and yes, so that's very important because around here with supraorbital and supratrochlear arteries, which is a part of the internal carotids here, you can anastomose and then with the internal and external and then come into the orbital artery here. If you see here, with the facial artery here, it can actually anastomose with the infraorbital and goes into the dorsal nasals and then anastomose into the ophthalmic artery and then closes blindness. So, you have to know where they are, really, but are we going to inject that deep? No, we don't really inject that deep, to me, to be honest. But, our problem is the skin, right? It's the dermal part. So we inject very superficially. Usually it's just intradermal, so there's pretty much nothing there, but always, there's always, you have to keep in mind, just in case, okay? So how to do it? Let's do it. Easy peasy. Actually, I was thinking about, should I do a video of this so that you could see, okay, this is how I draw the blood and doing that, or did I bleed the patient out to death? No, I didn't. But I thought, this is so easy because basically you just take out the blood, only 4 ml, lesser than a teaspoon, and then chuck it into the tube, put into the centrifuge, spin, 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 spin. I go to the loo for 5 minutes, come back again, voila, it's there. And then you just shake, 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 shake. Done. That's it. Very, very easy. Easy peasy. And then you could see here that everything is separated, yeah? So when you centrifuge it, there's HA and the plasma here, and then you can just tilt the tube gently, and then it will just mix for you seamlessly. And then you will see how smooth it is when you inject it, okay? Let's have a look. First case, 33 years old. You can see that she has hyperpigmentation around her eyes. She also has eczema, obviously. You can see the fine wrinkles and everything. She's a classic case of it. There's a tiny bit of loss of volume as well. So what did I do? I only use PRP, okay, PRP with HA, and I got about 5 ml from her. I use cannulas. Why do I use cannulas? I can actually use CHOP, I could, really, but I prefer to use cannula because a lot of my patients, they don't want any downtime. Okay, they don't want little bumps and bruises everywhere when they go out. They just want to I look pretty as if I didn't do anything. I just look pretty. Yeah, that's what they want. So cannula will give you that perfect idea of it's just 2 holes, okay? So you just make an opening just draw the imaginary line from the lateral canthus and the ala, okay? This point is where the base of orbital rim, that's all. I make one entry here and another entry here. So the first entry here, I just use about 1 ml. Just put it above the suborbicular, over the orbicularis oculi. Very, very superficial. You can imagine. You will see in the video how you can see the cannula very thinly, and that shows that it's on top, because you want it on top, okay? And then I also support it underneath the muscles as well, okay? And then other than that, why don't I use the whole thing, all 5 ml? That's a lot of volume, isn't it? It's going to be too much. It's going to be too much. And don't forget, it's going to swell. You don't want your patients to come back the next morning and say, oh my God, I can't open my eyes. No. So I think they always wanted something a little bit more too on the cheek, like a little highlight on the cheek. You can imagine that, right? So that's what I did. So I used the rest of the volumes on the cheeks, okay? So they have a little glow on their cheeks in the morning, like a highlight. Let's have a look. So I usually give them a local anesthesia only on the entry point only, okay? And then just a small opening. She said it's not that painful. There's no need to, do a nerve block at all, because when you do a nerve block, the patient can't. It's just very unnatural, and they don't like the feel of nerve block. And I want the patient to be able to feel if something goes wrong at the end. I want them to be able to tell me, patient, doctor, there's something wrong, so you know that, oh, it might go into a vascular or something. Okay, if you could see, I putting it on the top of orbicularis oculi, very, very superficially on top. You could see that, see? Right here, I just wanted to touch up in between the lid and the cheek. That's where usually, the junction between the lid cheek is where it's has the thetic fibrosis there. I just wanted to just subsize a little bit and then just smoothen out between the eyes and the cheek, yeah? Which is very important, because usually if I use the fillers, you can imagine, if you put it that superficially, it's going to tingle or it's going to clump for sure. You can't use anything else. But with PRP, you can use it, and it can just smooth out in between this junction perfectly. And then I just put more on the cheek, just a tiny bit, just to give her that glow on the cheek. And then here, I make another opening so that I can address more on the under eyes, okay? More on the under eyes. You can see the cannula here. It's very, very superficial. You can see, very superficial. But do it very gently, very gently. See? She's fine. It's not painful. She's okay. See? You see? And you can't see any tingle effect. That's a good thing about it. Because I'm always worried about if I use non-cross-link HA, and that superficially, it's going to cause tingle effect. My patient's going to hate me. They're going to come and see me and say, I hate those bluish tingle effects. Why did you give me this? No. But at the same time, a lot of Asian patients usually have like tiny fine lines. And how am I going to get rid of it? Lasers? Oh, they don't want to do those downtime with the lasers. But this, you can actually touch up with those fine lines superficially, so seamlessly. Okay, And then I thought, oh, I want a little bit highlights on her cheek so that she has a little glow and her high cheekbones, just tiny bits, just touch up. That's all at the end. Easy, isn't it? Very easy. So let's see the result. You can see that the volume is much better. Can you see? The volume is much better. Even more. See? This mild, it's a bit swollen, just tiny bit, mild swelling immediately. And then 2 months afterwards, it's still there. You can see that the volume's still there, right? I didn't touch up at 1 month at all. At first I thought, it shouldn't last, because usually with the non-cross-linked, 1 month, yeah, you're lucky if it lasts. 2 months, it's still there. So maybe there's a synergistic effect between these two working together, right? So with 2 months, without anything, she still looked great, and she's very happy because it's very natural. Can you appreciate it? See, with the under eyes here? Yeah? Can you see the dark circles? It's much improved. I mean, it's not completely gone, but it helps a lot. It really helps, and she's very happy. So, another case. She's a bit older, this lady, 54 years old. So, you can see that there's lots of wrinkles, thinning of the eyes, lots of volume, a little bit over the eye bag. She's done everything, but then, it doesn't really help anymore. She's run out of ideas. And she said, oh, can you help me? I want to look a little bit brighter for my daughter's graduation. I was like, oh, okay, let's see how am I going to do it. So I did PRP for her because she can't take any downtime at all. So I did PRP for her, and the same thing. So with her, I've got 5 ml from her, and I used the 25 gauge needle, 50 millimeters long. And I think this is great. Do you think so? Yeah? For 2 months? Yeah? It's very natural, because the thing is, this lady had fillers done before, and she hated it. The way she smiles, she has a very strong orbicularis oculi, especially on the medial band. So you can imagine when you smile already and you have thick medial band already, you could actually, use you can see the lumps and bumps. Yeah, see? Can you see that? Yeah, it's amazing. So how about this lady? And I thought, that lady lasted for 2 months, all right? But then with that lady, it didn't last very long. With one treatment, immediately, it's very good. It's a bit puffy. You could see that it's good. But then after 1 month, it's sort of gone. She works out a lot. That's the thing. So it depends on the patient's lifestyle, too. If the patient works out quite a lot, your metabolism is quite good, it's going to go away, gone quite fast. So I actually injected another one, and then this is the second result after 1 month, after the second treatment. So she's very happy, very happy. It looks very natural. So how about, I thought, this is not going to last very long. Let's do PDO. Let's do threads. So with this lady, she's very young. And so I gave her this spring thread first. I placed it on periosteally along the bone to help to strengthen the ligament, as well as pushing the septum, the orbital septum as well. And then I inject the PRP suborbicularis oculi and above the suborbicularis oculi as well, and on the cheeks. Okay, let's see. See? Can you see? She's very happy. Can you see? The under eyes is gone. It's gone. She's very happy. At first she came in, I just want fillers. I don't want anything else. And I was like, are you sure? Because the way you smile, and I think that, with fillers, it might not give you that natural looks that you want. And she was like, so what are you thinking of then? How about this? Let's try. Because the hyperpigmentation that you were after I don't think filler is going to be the only answer for you. She's very happy. See? So after that, See, when she smiles, you can't see any lumps and bumps. That's the most important thing, okay? So another case. I also use threads as well. And likewise, after 1 month, see? You see that the under eyes is much better. The under eyes, the darkening of the eyes is much improved. This little girl, 23, she's not a little girl, she's actually here somewhere with me. And she had threads done on the first treatment as well as PRP. And then I gave her the second treatment as well, just with the PRP. So at first, you could see a bit of puffiness because I injected them, placed the threads and the PRP. And then after 1 month, I think it's sort of gone already. It's not as good as I expected. So I injected more PRP for another session, and now this is her. So she looks great. So that's see? So the hollowness is actually gone. The pigmentation has been improved as well. Yeah. So overall with PRP, you know that it has regenerative effects as well as when it's combined with HA, it can help to give more natural results and make it more long-lasting. It's very important for patients right now. We're going back to all natural looks now. We don't want those lumps and bumps and problems like Tyndall's effects anymore. But with PRP and HA together, it really helps to tackle like every single problem of the under eyes. And thank you so much, Region Lab, for having me and share one of my favorite indications of the under eyes. Thank you for having me. Thank you.
Thank you so much, Dr. Van Ravi. That was a really good insight into using PRP alone in a way, but also in combination with threading. We are running a little bit out of time, unfortunately. Our second speaker, Dr. Anna Hu, is actually also going to give us a little bit of an insight into how she uses PRP. And interesting thing is that Dr. Anna Hu is the founder of Own Clinic, but she also thinks about, it's not just a question of having a look at somebody from the outside, but also from the inside. So regenerative medicine is obviously part of that. Mm-hmm. Thank you.
Thank you.
Do you have a presenter note in your slide?
No. Okay. Very good morning to everyone, and thank you very much for Region Lab for having me here to share my insights about PRP treatments. I'm Dr. Anna Hu from Kuala Lumpur, Malaysia. I'm an aesthetic physician and wellness enthusiast to assist my patients to have more optimal health. So the topic of discussions for today will be the PRP in skin quality improvement. I'm the founder and CEO of Anna Hu Clinic, my own clinic. And one of the visions that we have, the reason why I'm sharing this is because the visions is tied up to the way we select the treatment for the patients. One of the visions that we have is we would like to have assist our patients to achieve optimal health, not only physically from internally and external appearance, also emotionally from how the patients express themselves, so that with the physical and emotional enhancement, they are able to function their best in their social circle. And for both of this, the PRP play a very important role in the treatment options as well. So PRP, we're working on skin. So skin is one of the visual indicator of health, because not only it's an external layer of our body, it's also indicate the fitness, the vitality, disease and nutritional status of the body. So if the skin color is yellow toned, it indicates there is certain degree of deficiency. How do we make it into a pink color, we can enhance on the vitamin D3. So besides that, the skin also contributes to the perceptions of the facial attractiveness. For example, if the patients have eczema, it's one of the indications that one of the possible cause, it could be because of the breakage of the barrier of the immune system reactions as well. And then when people perceive us, there will be a certain degree of anxiety that they will be able to perceive. Besides that, it's also influence of the perceptions of age and health, such as the fertility and reproductive health, and influence how we interact with others. So in a recent global survey, 94% of people wanted to improve their facial skin quality. For most of the patients that come to the clinic and approach to us, almost like 80% of them, they wanted to start with their skin quality improvement. And there are many modalities available nowadays of skin quality improvement. So how do we talk or educate or consult the patients during that particular first consultations? So there's a consensus among the clinicians that skin quality can be described using 4 different categories. So we will guide the patients through on what are the treatment options which will improve on which are the segment of the skin quality. For example, on skin firmness, more on elasticity and tautness and the hydrations of what you can visualize from this particular patient's photo. The laxity and the dryness, which will be able to assist them in the improvement. Besides that, for the skin surface evenness as well, for some patients with a significant open pores, or scarring tissues on the skin, we'll be able to assist them in reductions of the pores, evenness of the tone, and hydrating the skin. Not only that, when we already achieve certain degree of results, when the patients presented with a significant of malfunctions of all the 4 compartments on skin firmness, tone, surface evenness, we'll be able to assist them in regain back the skin quality and then to make it glow again. I'll make it slightly faster because we are running short of time. So when we share with the patients during the consultation sessions, skin quality, it's extremely important to set the expectations for the patients. The expectations sets from not to put them into high expectations that one sessions of treatment will be able to give them the results that they want. And certain treatment options, they might need to have a repeating treatment. So for PRP per se, in our setting, it's a regenerative treatment from the perspective that the more you do it, the better the results will be. And the more that you do it, the better the quality of the skin will be and the younger the skin will be. At the same time, we also let the patients know that when we are assessing the skin quality, it's important to look from the 3D perspective. The 3D perspective is, if you want the skin to have good elasticity, the support system underneath the skin need to be good. Where the support system coming from is from the bone, from the fat pad, and also from the muscle. Besides that, if you want the skin to have good skin color, the inflammations management for the patients on the skin is important as well. Identify what could be the cause that leading to the redness and the pigmentations formation. So that is from anti-aging and the wellness perspective. And the PRP functions on skin remodeling and skin regenerations helps a lot on this aspect. And if we want the fine lines to be reduced, skin hydration is extremely important as well. Where the hydration coming from? The nutrition from the plasma. If you are able to feed the patients slightly more nutrition prior to the treatment, with the enhanced versions of the serum, we will get better results. And what context of nutraceutical or the nutrition that we need to support the patients, if you have interest in this, we can talk later because of reductions in time for today. But overall, when we really looking back, or when I really looking back of the options that we offer for the patients, Nowadays, there are so many different types of treatments available. And sometimes, we even ourselves also confused. Because I'm running to clinic with 5 doctors with me, so sometimes the doctor, during the consultation, they will ask, so many options, what are the things that I need to promote? Is it for sales perspective, or is it from the patient's benefit perspective? So with all the treatment options available, from the perspective of optimal health, one of the criteria that I decide for my patients is we do not use any synthetic product or semi-permanent product to give rise to the collagen stimulations. So if I would like to keep repeating the treatment, it needs to be as safe as possible, as natural as possible, and this is also one of the ideal patients buying the treatment. So what's PRP? I believe everybody knows what's PRP due to a fabulous presentation from Dr. Kwan. So it has been utilized in medical field since year 1950 and have been utilized even more since 1980 onwards because the identifications of the chemoattractants inside and the growth factor inside. The most important thing, the reason why I select this treatment for my patient because it's autologous. Safety comes first. Because if I would like to inject something on my face, the number one important thing is safety comes first. And this is the tissue regenerations and how the wound heal. The reason why this slide is important because for tissue remodeling and tissue regenerations, it's ongoing. It doesn't just stop within 1 month or 2 months. And then what we normally do is actually, this will set how frequent or when should we repeat the treatment. And from my experience, the duration for me to repeat the session is actually every 2 to 4 months once. So this is the PRP healing process from the homeostasis, inflammation, regenerations, and remodeling. PRP treatment literally able to shorten the healing time. And for me to select the right PRP sets in my center, it's also come along a very, very, very turbulent journey from the first PRP set up till now. So what's the most important thing to me or to the patients is the quality of the product and also the safety. So for the quality of product, Dr. Kwan already shared just now. And for the safety-wise, it's already being shared. But the most important thing for me, I would think that it's a certified lab, and then it's a closed circuit. Besides that, it's non-pyrogenic and biocompatible component. This is extremely important. The process of drawing a PRP is being shared as well, so maybe I'll fast forward this one. But compared to the sets that are being utilized by Dr. Kwan just now, I'm using the BCT set where each tube I will draw 10 ml of blood. So for a single sessions of treatment, I will draw 30 ml of blood, which I'll be using like 3 tubes. So the injections technique per se, long time ago, I inject intradermal, subcutaneous, and supraperiosteum. Nowadays, I only perform intradermal, subcutaneous layer. The others are PRP treatments performed by others clinic. So for intradermal injections, I perform on the forehead, nasolabial fold, tear trough, and the marionette line. This is the injections manner. The intradermal injections. The reason why intradermal injections is because I would like to create a mechanical stimulations, not only the PRP, nourishings, and the growth factor injections at the tissue itself. And for subcutaneous injections, we do infraorbital, zygomatic, preauricular, nasolabial, and also the chin. So for more detail, if you're interested, you can come and then we can chat about it. So those white color triangle are the area of injections where we perform it subcutaneously. So injections in fanning manner as well. We use the introducer with the cannula and then we inject underneath. So I won't showcase the whole video, but at least one injections area. So somehow in a different part of the world, the way we inject is a bit similar. I would believe that every one of you might be doing exactly the same thing as well. So for 3 tube of the product, generally I will have around like 15 to 20 ml of PRP. And of this 15 to 20 ml of PRP, I will spread throughout the whole face. So other treatment options, which is more famous in the market, it will be the microneedling. And then we apply the PRP on the skin, or combinations with fractional CO2, then we applied it on the skin, or in a napatch, which the first injections method when I first started the in aesthetic medicine field. So this is the appearance of the patients immediately after the PRP injections. The adverse reactions or some advice for the patients is erythema, the redness usually will last 1 to 2 hours. Swelling, usually it will recover the next day. And for swelling wise, I would think that the Region Lab tube have been giving me a peace of mind, because prior to this, I was been using other PRP kit, where the PRP kit, there is no separation gel to separate the pro-inflammation white blood cell. So with the presence of the pro-inflammation white blood cell in the plasma, sometimes the patients might experience significant swelling immediately after the treatment or the next day after the treatment. So for the recovery-wise, it's significantly less painful or more comfortable for the patients. Ecchymosis is more when we injure the blood vessels. Skin stiffness is because 30 ml of or 20 ml of product being injected. So usually it will dissipate in about 3 to 4 days. And this is the patient's PRP journey. So the reason why I shared the emotion expressions from the facial treatment itself with the PRP, you do notice that the harmony part of the face is significantly improved after the treatment. This is after 5 sessions. So question, in our practice, it's difficult to get the patients to come back for same treatment again and again, and this might be something for us to work on. So the patient's treatment planning, consultations is important. Because of short of time, maybe I will fast forward this as well. Anyone interested can come and look for me. So treatment phase itself, it will be 2 months once. For maintenance phase, it will be 4 months once. Enhancement phase, we will do the treatment 2 months once. So by doing so, I pass back the baton to the patients for them to decide how good the results they wanted to have. If they want even an excellent result, come and get it done 1 month once. So it's no longer I'm the one who decide for the patients, but the patients make the decisions themselves. So this is a patient's PRP journey. Again, when we really look back at the skin quality enhancement of the 4 segments of treatment quality that we wanted to have, the before and the after. But for this, it's a combination of treatment. Because what I believe is PRP, this is the food for the skin. And at the same time, I can give other stimulations to enhance the results. And if you're looking at an under eye area for single treatment versus continuous 4 sessions, you do notice that the skin quality, the thickness of the skin improves significantly as well. So this is another patient, also with a 4 months interval. If we compare the before and after photo, the skin quality improves significantly. So if you can get a good photo record, it will never be, we will never experience that patients come back and there's no results. This is another patient's journey with the Hori nevus, combinations of PRP with Q-switch anti-YAG laser. Laser, we did it monthly, but the PRP, we did it every 4 months once. So how effective is PRP treatment? So from the photo, you do notice that the result is good, and the factor contributing to the difference in result also shared by Dr. Kwan. Contraindications also shared by Dr. Kwan just now. And as a conclusion, it's a treatment that works, and it's important for us to have repeating results and to get a good kit so that we can serve our patients better. And it's one of the most effective regenerative treatments that I can offer to our patients, which we can repeat again and again. With that, I thank you.
Thank you so much. Thanks, everyone, and thank you, both of you. I'm sorry that we've run out of time for the question. We are at booth 75. 95, sorry. I don't even know the booth. If you have any questions, I'm sure both doctors would be happy to be there for a while, and that way you can ask them the questions and they'll be happy to share whatever you wanted to find out more. Again, thank you, and so sorry for running out of time. Thanks.